ever noticed the different breathing patterns from your patients and clients? Some of them breathe only using their belly, while others breathe only using their chest. Well, what's good and what's bad, and why are they breathing like that? Well, in this video, we're going to talk about how a water bottle can be a really valuable tool that can help you teach and understand this concept better so that you can provide your patients and clients with the best overall respiration strategies. To really respect patterns and how they influence movement, we first need to understand normal biomechanics of breathing. Now, you can get very detailed, but for this video's purpose, we're just going to go over a couple of simple concepts to understand the overall structural influence. So we have the pump handle, which is the sternum, and then we have the lower rib cage, which is the bucket handle. When you inhale, the pump handle should expand anterior to posterior and open up the chest wall, and the bucket handle should expand laterally and then come back medially. Vice versa happens when you exhale. When you exhale, the bucket handle is going to close down, the pump handle is going to close down. So the other way you can think about saying this, on inhale, you expand, and as you exhale, you compress and you compress. Now, when it comes to actual airflow, the easiest way you can really remember how air is going to be manipulated is that air is like a lazy person. It really is trying to find the path of least resistance. So wherever the body has compression, when that air is met with that, it's going to go the other way. It's not motivated, it's lazy, so it's going to find where is the easiest route I can take. I don't want to push up against that resistance, so that's where air is going to go, and that's how you start to understand these patterns, because air is just following where there is not resistance. So we now understand normal expectations of the pump handle and the bucket handle during respiration. But here's the thing. The majority of your patients and clients are not going to be normal. They are usually met with patterns that are created from postural habits, from breathing compensations, from day-to-day activities, from sitting. There's a lot of variables that create the pattern, but what it does is it starts to change the structure. And it's really important because the structure is going to dictate the movement capacity available to your patient or client. So what we can do is we can understand these patterns with a water bottle. And this water bottle is really useful for you to understand the patterns better, but also to get your patients and clients to understand the patterns better, so that way when you give them breathing exercises, they see the value in it. Now, for this intent and the video's purpose, I just want you to walk away with understanding the why and the how behind these patterns. If you really want to go into more detail, I would encourage you to check out the Performance Redefined course, where we talk about assessment strategies and exercise selection and programming for these different patterns. So the first pattern that we are going to talk about is the wide infrasternal angle. The wide infrasternal angle comes as a result of compression and expansion. What does that look like? Well, if this is the front of the human body and this is the back, the wide ISAs are met with compression at the pump handle. That compression at the pump handle yields expansion at the bucket handle. But here's the thing, look at the water. The water is representing air. The air is going where? To the path of least resistance. So when this person goes to take an inhale, where is air going to be biased? Well, compression is where my fingers are at the pump handle, right? And when we talk about compression, we're talking about muscle activation, muscle activity that is holding that sternum, meaning the chest, and the mid traps, upper traps. Those muscles are squeezing A to P, anterior to posterior. That is going to create compression and expansion at the bucket handle. So these are the belly breathers. So they are the ones that are inhaling and exhaling through their belly. Why? There's no other option. There's too much resistance here. Air is going to shy away from that, and it's going to just move the bucket handle. So to start to fix and to start to work on changing the structure, what do you think needs to be done? Well, we need to change the compression. We need to get their compression where their expansion is, and their expansion where their compression is. So what does that mean? That means we need to compress the bucket handle and expand the pump handle. How do we do this? Any sort of side-lying activity is a great way just to start to introduce this, where your position sets your patient or client up for success. The side-lying position will take their normal pattern of a wide ISA, expanded bucket handle, compressed pump handle, and start to shift them towards this. That's going to do what? It's going to increase their movement variability. Because at the beginning, we talked about how the structure dictates the limited movement capacity. So when you start to change the structure, you change the capacity. The second pattern is a narrow infrasternal angle. Here's the thing, it's pretty easy. It's the exact opposite of what we just talked about. These individuals are met with compression at the bucket handle and expansion at the pump handle. So what does this mean? This means that when they breathe, they're going to usually get more chest available motion, and they're usually going to have a harder time to expand the bucket handle. So that's not a pro or a con, it just determines their movement capacity. So for these types of individuals, we want to work on getting them a little bit more compression at the pump handle. Why? That's going to increase their movement variability. So an easy starting place for the narrow ISAs is a supine or a hook lying position. With the effects of gravity, you're going to get a little bit more compression at the pump handle and a little bit more expansion at the bucket handle. And this is going to overall help them increase their movement variability due to an easier position of movement capacity.